greet you all who are watching this video and have subscribed to our channel of SUUBI Community Health Initiative. Today we would like to answer some of the questions that you have. You might be asking yourself, why are we calling ourselves SUUBI? Why are we doing what we are doing? And when did we begin? So SUUBI Community Health Initiative began in the year 2019, and it began as a concern of the church towards the need of the health services which are in this community. So this is a community whereby the health facilities are a bit distant, and being that they are distant, then it means they have a lot of health problems that are in the community. So what the church did, together with the entire community, the church mobilized and they looked for many different people who could work on this problem which was going on. And then what happened? They mobilized many medical workers, I myself being inclusive, and in the process we ended up getting an opportunity of linking up with a team which offered us eye services. And this team screened all the eye conditions and provided the treatment for those who needed, and as well the reading glasses to those all who needed. And all together we saw over 134 people who received all this treatment and all these services at a free cost. So in the process, the church still has been going on to ensure how can we much be more organized to ensure that this happens. And they have ended up forming up this organization which is called the SUUBI Community Health Initiative. And why do we call ourselves SUUBI? The word SUUBI in Luganda means hope, and what the church desires is to establish an initiative that will be a source of hope for health services in this community. And why do we involve the word community? Because it is communal. The entire community is involved in this. Even basing on our first eye camp that we had, all the people were involved in the community. The religious leaders, the community members, the political leaders at the level C1 and as well sub-county. And they worked so much in mobilizing all the people who came. And they worked so much to make sure that they care for the visitors, for their welfare, and everything went on well. And all together, we received all that number of people from the sub-counties of Kamila and Chichusa, and it was well enough. So that is how we are. And in the process, we formed an organization to continue to establish ourselves to be a bit more organized so that we can be able to work more and more to respond to all these health services, health problems. Now, why do we do what we are doing? Our aim is to make sure that we respond to the needs of health services which are in this community. At the moment, we are working through the medical missions or the medical camps, but we are not limited to that. We are doing that simply because at the moment it's what we can access. But we are having a lot of hope that we can do even many more other activities which shall be able to respond to the needs of health services in this community. And as we talk by now, we have already an organized structure of leadership which we have that is working on, and it's making sure that everything is going on very well. So that is why we are calling ourselves SUUBI, and that is how we are. So we began slowly And where we are at this point today, we are in a situation whereby there is quite a lot of need in the community, and we need a lot of ways of seeing how much we can respond on this. And we are still in the process of registration. We hope to finish very soon, and so that we get fully established very well. And at the moment where we are, our main need at the moment is we desire to work more and see that respond to this community. At the moment, we have a site where we hope to establish our offices, or maybe a health facility, provided the provisions have come, and we hope so that in case everything goes on well, we shall have a permanent facility which shall be established in the community and which shall be running to ensure that all the health services are rendered to people at their own localities. Yeah, thank you so much. God bless you.